Hello and welcome to this training module on patient involvement in early feasibility studies. I'm Yasemin Zeidel from the European Patients Forum, and I'm pleased to walk you through the work that we at EPF have carried out together with Global Heart Hub. EPF and Global Heart Hub are umbrella patient organizations, and we're responsible for contributing patient perspectives to the HEU-EFS projects. This presentation explores the critical role patients play throughout the entire clinical investigation lifecycle, from study design through post-trial communication. Understanding when and how to meaningfully involve patients is essential for ensuring that medical device studies are rigorous, ethical, and genuinely patient-centered. We'll walk you through three key phases: before the study begins, during the trial, and after it concludes. Throughout an early feasibility study, patient involvement has two roles: patients as study participants providing clinical data, and patients as advisors contributing lived experience. Patient advisors co-create clinical studies together with sponsors and researchers. This is distinct from their role as study participants. Let me give you some examples for this. In the pre-trial phase, patient advisors can shape study structure by helping develop clear informed consent forms and other patient-facing materials, ensuring that study participants fully understand information about the study and the device, as well as associated risks and benefits. Patients can also assess whether proposed study activities and visit frequency are realistic and identify needed support mechanisms. Another option is involving patients in evaluating the study site accessibility, including parking, transportation, and physical access to address real-life needs. In terms of data collection, patients can contribute to data collection planning by identifying unmet needs and health outcomes that matter the most to them. Finally, patients develop training guides and can provide input on diversity, equity, and inclusion to ensure study accessibility for all populations. Throughout the active trial phase, patients remain active collaborators, not just study participants. There are two primary ways patients can continue to contribute during this time. First, patients provide ongoing support to data collection and analysis. This includes giving feedback on study processes, commenting on patient support mechanisms, and offering their perspectives on questions asked, data collected, and tests performed. Their real-time feedback helps ensure the trial runs smoothly and that participant needs are being met. Second, patients provide input on potential device modifications. Drawing on their direct experience with the device, patients can identify opportunities for usability improvements, suggest design changes, and recommend accessibility adaptations that could enhance the device's effectiveness and user experience. After the study concludes, patient involvement continues as active collaboration in the final phase. Patients can be involved in analyzing results and creating lay language summaries that translate technical findings into accessible language for all stakeholders and users. The study team should conduct a comprehensive evaluation with patient input and gather suggestions for follow-up research. Post-trial follow-up and transparent communication with participants demonstrates respect, keeps them informed of achievements, and maintains trust in the research process among patients. To make patient involvement systematic and effective, it's best to establish a structured patient engagement plan before the study begins. This outlines objectives, activities, methods, and the timeline. You may also define key performance indicators to track engagement effectiveness, measuring both the frequency of patient activities and how patient feedback was integrated throughout the study. Patient involvement activities should be tailored to your study context and may include focus groups, surveys, workshops, the setup and maintenance of patient advisory groups, or structured document reviews to ensure clear, accessible language in all patient-facing materials and processes. Thank you for watching this module on patient involvement throughout clinical investigations. Meaningful patient involvement strengthens research, improves outcomes, and ensures that medical device studies truly serve the needs of patients. Don't hesitate to reach out to the HEU-EFS project, as well as the European Patients Forum and Global Heart Hub for further information.